From the PEP Radio Newsroom, we have this special report about transgender healthcare records in New York. Judge blocks the Trump Department of Justice from seizing trans youth's medical records from New York City hospitals. Advocate is reporting a federal judge handed Lambda Legal and the American Civil Liberties Union a significant victory on behalf of transgender young people and their families on Wednesday, temporarily blocking the Trump administration from obtaining identifying information and sensitive medical records belonging to people who receive gender-affirming care as minors in New York City. U.S. District Judge Katherine Polk Failla restrained the Department of Justice from seeking, receiving, using, or disseminating the information through grand jury or administrative subpoenas. She also prohibited NYU Langone Health from turning over protected records. Failla provisionally certified a class covering people who receive treatment for gender dysphoria while younger than 18 at New York City healthcare institutions, including NYU Langone and Mount Sinai Health System from January 1st, 2020 through May 5th, 2026. The ruling follows months of retreat by New York hospitals under federal pressure. NY Langone ended its transgender youth health program in February after the administration threatened federal funding for institutions providing gender-affirming care to minors. Mount Sinai curtailed their care days later. Then in May, NYU Langone notified patients that federal prosecutors in Texas had subpoenaed records and provider identities, prompting 3 families and 2 young adults to sue before the hospital could disclose them. The judge found that the patients would face irreparable harm without intervention and were substantially likely to prevail on claims that the subpoenas violated their 4th and 5th Amendment rights. Disclosure by NYU Langone would be likely to be a breach of New York's physician-patient confidentiality protections, she concluded. This subpoena, expressly targeting members of a particular and uniquely vulnerable group, both shocks the conscience and rises to the level of the most egregious official conduct, Failla said during a hearing earlier in the day, according to Reuters. The Justice Department has said the records are connected to an investigation into possible drug misbranding. The plaintiffs argue that the inquiry is a pretext for the administration's campaign to eliminate gender-affirming care. Using subpoenas to attain the identities and sensitive health information of transgender young people should send chills down the spine of every American, Lambda Legal attorney Omar Gonzalez-Pagan said in a statement. Chase Strangio, co-director of the ACLU's LGBTQ and HIV rights project, said families should be able to trust doctors to protect their private information from impermissible and harassing demands. Breaking, a federal judge temporarily blocked the Trump administration's bid to seize the medical records of trans youth. The ACLU wrote on Blue Sky, "Will continue the fight to defend trans youth's right to privacy and end this harassment for good." At least 8 federal courts previously blocked similar administrative subpoenas, Lambda Legal said. The Justice Department then turned to criminal grand jury subpoenas issued from Texas. The temporary order protects patients while Failla considers longer-term relief. That's our brief but important report. As news develops throughout the day, be sure to turn to PEP Radio for news impacting marginalized communities. From the PEP Radio Newsroom, I'm David Moore.